I guess one of the major problems with schizophrenia patients is a lot of the current available treatments lead to side effects, lead to other symptoms that are negative, that leads to discontinuation. Um, are there any side effects or are there any unintended consequences of this treatment? And how does this treatment reduce the symptoms in these patients?
Excellent question. Unfortunately, we're yet to come with a medication for the treatment of schizophrenia that has no side effects. And whoever does may very well be a top contender for the Nobel Prize. So to answer your question, every available antipsychotic on the market has some side effects. Side effects that patients experienced in this study were consistent with previous side effects observed with either treatment with aripiprazole or previous studies of Aristada or the previous studies of Invega Sustenna. But what is interesting is that there's not a single particular adverse event that could be responsible for more discontinuation or higher discontinuation rate than the other side effects. So, for example, just to mention a few side effects, in Aristada group, the patients who were assigned to Aristada treatment, and again, this was a randomized, double-blind, placebo-controlled study, which I will touch base a little bit later because it was really, really hard to maintain the blind in this particular study. So in Aristada group, the adverse events that were observed were consistent with what we've seen in previous Aristada clinical trials: somnolence, akathisia, headache, and weight gain. So those were the most commonly observed. But again, none of the patients discontinued participation in a clinical trial because of any of these adverse events. Your second question was related to the efficacy. So if you take a look at this study, and again, remember that there was no placebo group, the primary efficacy measure was designed in a way that we looked at efficacy within the group. What that basically means, we looked how the patients within Aristada group did at 4 weeks compared to baseline. And the same thing looking at the Invega Sustenna group. And definitely there was significant improvement, statistically significant improvement over the course of 4 weeks. And looking at the secondary efficacy measures at week 9, at week 25, this improvement continued across both of the treatment groups. So both Aristada and Invega Sustenna were effective in the treatment of acute exacerbation of schizophrenia among the patients who were hospitalized for the worsening of their symptoms. And that effect continued throughout 25 weeks.
Okay. Now, for schizophrenia patients, is one of the reasons that it's so difficult to get new treatments and to get kind of that universal treatment that helps such a high percentage of the patient population is because the disease can manifest so differently in different patients?
Absolutely. Schizophrenia is a very heterogeneous illness. And in many ways, it is quite unpredictable illness. We have no ways to say whether this patient is going to have some X number of exacerbations over the course of years, even if the patient takes medication, compared to the other patient who may have double X or 0 exacerbation over the course of the same number of years. If you ask me, I truly believe that within the next 10 years, the group of schizophrenia patients, or what we call today schizophrenia, will be separated in at least several groups and different diagnostic entities. But that could be the part of the reason. And the other part of the reason why the medication is why these patients experience frequent exacerbation is the lack of compliance. These patients quite often simply don't want to take medication. So when Alzheimer's has developed the medication that can be given to the patients every 2 months or actually every 8 weeks, this is quite a step towards actually having these patients not come very often to the office, or when we talk about transitioning between an inpatient care and an outpatient care, when we discharge these patients on the combination of Aristada 1064 and initiation regimen that was conducted over 1 day, 30 milligrams of aripiprazole and Aristada initial, these patients are covered with medication for 8 weeks. So we really don't have to worry, why are these patients taking medication during the initial period of the discharge from the hospital. Just to comment that a little bit more, there is a reason we chose Invega Sustenna as the second group. And actually there are two reasons. Number one, Invega Sustenna seems to be the number one prescribed atypical antipsychotic for the treatment of schizophrenia. And number two, the similarity between Aristada and Invega Sustenna is that both of them do not require overlap with the oral version of the antipsychotic. And so the team has decided that that will be actually the best to see how both of these treatment groups will fare within the similar setting.